I'm Janet Meirelles. I'm a registered nurse and a certified diabetes educator. I've been a certified diabetes educator for about 25 years. I'm also a certified health education specialist and a public health nurse. And in that career as a diabetes educator, I've worked in public health, inpatient in hospitals, outpatient in classes, teaching pregnant women. And one of the most important new areas that's come up is we know now we can prevent some diabetes. And I am very passionate about this because I became a diabetes educator to prevent complications. And now I can even start earlier. The course on prevention strategies for diabetes will include what we've learned from the research, including exercise, what kind of exercise, how long should it be, what kind of diet, weight loss strategies. Weight loss is a tremendously important part of prevention, but boy, is that tough. So a great part of the class will talk about novel tips and ways to motivate your patients and maybe yourself, because this is a problem as we grow older, keeping the pounds off. There are also supplements that seem to reduce the risk and medicines that patients can take. So we have a lot of ways now of looking at this. I'll discuss the screening things, the blood tests, and there will be lots of time for students to interact and to ask questions and to hopefully contribute their own tips about diet and exercise. What I'd like to share is how much this idea of prevention has taken hold in the diabetes education community. I just came back from the National Convention of American Diabetes Educators, and there were 6 courses just on prevention, which is quite something when you consider all the topics they have to cover, that this was a very important area. And they could be on the forefront among their colleagues if they knew something about prevention. You don't have to be prepared. I will use the same language I would give to a lay audience. You just need to be very interested in this brand new area. I think what you'll get from this course is a wonderful background in healthy living. You'll learn what are the foods that most protect us against heart disease and diabetes, because they're very closely linked. And actually, preventing diabetes may mean that you keep your brain longer. So if you're interested in keeping your brain and your heart healthy, this will help. What I think students will enjoy most out of this prevention class is improving their own general health. And they'll be able to pass it on to patients, because sometimes patients get a blood test and it shows that their blood sugars are creeping up, or their cholesterol, or their blood pressure. And the doctor says, you better be careful because you're on the road to getting diabetes, and he doesn't say anything more. And you can be the key person to help that person make some important decisions. The most challenging part might be asking yourself what you're not doing and how you could improve your own behavior. What will make a student successful in the prevention class will be an open mind about behavior change and motivation. The purpose is not for you to go out into the world to nag people. The purpose is for you to go out with the tools to convince people why it's important to make the changes, and then tell them how to make that easier. I think students will be surprised about how much benefit can come from making these changes. That this is a way of turning back the clock from being a sick, middle-aged person on the road to disease and going back to being a healthier person. This class, Prevention Strategies That Work, is offered at Climb for health professionals. For the lay people, there are a few classes out there, but they would be fairly limited and short. This is 4 hours, and you're not only going to learn what is necessary, but how to give this to the patient in the way that will make behavior change happen.